Good afternoon, everyone. Welcome to our community-based organization vaccine toolkit discussion group. We're going to go ahead and get started. My name is Courtney Wheeler. I am one of the public health program managers here at the National Indian Health Board, and I want to welcome you as we get into our discussion. But there's a few couple things I want to go over first. So as you know, the National Indian Health Board is a 5013C organization that was created by the tribes over 40 years ago to advocate and improve health of American Indian and Alaska Native populations. We work in the areas of public health, issues related to health, as well as policy in Indian country. A few housekeeping items. This webinar is being recorded and we'll be able to post the recording in a few days on our website. We do ask that during the presentation, you keep your microphones muted. You will be able to ask questions or add comments in the Q&A box, as well as the chat box. Once we get to the Q&A portion, if you raise your hand, I can unmute you if you prefer to ask your question verbally instead of using the chat box or the Q&A box. If you experience any technical difficulties, please message me in the chat. I will be moderating that throughout the presentation. Once the session is over, you will receive a post-webinar evaluation. We do ask that you fill that out just so we can make sure we're meeting the needs of the tribes, as well as making sure we have future discussion groups that are relevant to the information you are seeking. So today our presenter is Stephanie Erskine. Okay, from the Centers for Disease Control. Stephanie is a behavioral scientist who leads evaluation of social marketing campaigns in the Prevention Communication branch within CDC's Division of HIV/AIDS Prevention. She first came to CDC in 2002 as an ORISE Fellow with the Antibiotics Aware campaign, formerly known as Get Smart, Know When Antibiotics Work. She has also worked for the National Prevention Information Network and was instrumental in establishing CDC Info. Stephanie was the Director of Evaluation at the Association of Minority Health Profession Schools, a nonprofit organization in Atlanta that aims to increase ethnic and racial minority participation in the health professions. Throughout her career, she's been involved in a variety of projects, including designing and implementing interventions, program evaluation, and conducting behavior change research within vulnerable populations. She has worked on the front lines of numerous emergency responses, including Ebola, Zika, and now COVID-19. She is in her third deployment in the ongoing COVID-19 response, where she leads stakeholder engagement for CDC's Vaccine Task Force Communications team. Welcome, Stephanie, and I'll turn it over to you.
Thank you so much. Thank you for having me here. I'm honored to speak with you today. And I want to make one little correction. I was on the Vaccine Task Force leading the stakeholder engagement group. However, I have since rolled off, and when I say rolled off, that means that I've gone back to my normal position. But I was so eager to speak to you all that I agreed to do this in my normal job. So I just wanted to make that clear, but we still have someone who is on the vaccine task force who could answer your questions about the community-based organization toolkit, as well as a whole group of staff who will be happy to answer your questions and field your request. So with that, I will go ahead and share my screen. Okay. Let's see, that. All right. So like Courtney said, my name is Stephanie Erskine, and I'm a behavioral scientist, and I was leading the stakeholder engagement team on the vaccine task force. And today I'll take a little bit of time to go through our COVID-19 vaccination toolkit for community-based organizations. And before I do that, though, I do want to give you a quick overview of this presentation. I'll start with key components of CDC's communication work. talk a little bit about Vaccinate with Confidence, our CDC COVID-19 vaccination messages, our resources, and then I will get into the details of the community-based organization toolkit. So, in terms of the components of CDC's communication work, there are a lot of elements that go into the work that we produce as communicators. And that includes we conduct research and evaluation, we engage in crisis and emergency risk communication or CERC trainings. We do outreach to populations disproportionately affected by COVID 19. We do professional education and engagement, vaccine safety and effectiveness messaging. We respond to public inquiries, and those are from anywhere, and that's through CDC info as well as through different means like that come in directly to CDC staff personnel. And we support CDC vaccine programs directly. And just you can look at the slides. We have a couple of examples, but one that I will highlight is the COVID data tracker. And that is a map that anyone can go onto on the CDC website where we record at approximately 8 p.m. every night. We update it with the number of cases, the number of deaths, and just you see trends in terms of vaccine uptake as well. So it's a good way to just kind of see how the country is doing in terms of cases and where there might be pockets of cases, as well as where there are pockets of communities that have a lot of vaccine uptake, as well as those that have a low vaccine uptake. So, in terms of how we are talking about COVID 19 vaccine, we tend not to talk about vaccination hesitancy. Instead, we want to make sure that people are confident about their choices to get vaccinated for COVID 19. And so we use a framework called Vaccinate with Confidence. It is not a campaign. It is really the framework that undergirds all the work that we're doing. And it contains three pillars. The first is to reinforce trust. The next is to empower healthcare providers. And the last is to engage communities and individuals. And I'll go into those each in a little bit more detail next. So our first pillar is to reinforce trust. And our objective is to regularly share accurate COVID-19 vaccination, oh, sorry, COVID-19 vaccination information and take visible actions to build trust in the vaccine, the vaccinator, and the system. And what that means is that we always want to be transparent about our communication. We want to provide regular updates on the benefits, safety, and effectiveness, including updates from independent vaccine safety monitoring groups. And we want to proactively address and mitigate the spread and harm of misinformation via social media platforms, partners, and trusted messengers. And to further implement this pillar, we have a list of tools that we think support that, including the content on our website and different guides that we have to empower individuals to get the right information about COVID-19 vaccines. Our next pillar is to empower healthcare providers, and our objective is to promote confidence among healthcare personnel in their decision to get vaccinated and to recommend vaccination to their patients and the individuals that they come in contact with in their work setting. And when we say healthcare personnel, that's not exclusively to put. That is not exclusively for healthcare professionals that are clinicians. It includes anyone who works in a healthcare setting. So that includes people who work in long-term care facilities as nursing assistants. That includes the janitorial system workers. Anyone who is in healthcare setting and who has the possibility of being exposed to COVID, they have a higher possibility. We want them to be very, very confident about why they are getting vaccinated and to also show that among their colleagues. And so that's telling people I was vaccinated. And you may see people that walk around with stickers or buttons or hats. That's one way to, show others that you are confident about your choice and hopefully encourage them to also get vaccinated. And like I said, some of our tactics are to engage systems and healthcare personnel often and early to ensure clear understanding of the vaccine development process, the approval process, and the benefits of vaccination. We want to ensure healthcare systems and medical practices create a culture that is supportive of COVID-19 vaccine administration and support empathetic vaccine conversations and healthcare encounters to confidently address vaccine related questions and provide tailored vaccine information to patients. And I just want to highlight that piece about empathy. This is not an effort to force or coerce people into engaging in health behaviors that they don't feel comfortable about. Everyone has the right to ask questions, to be curious, and we should all engage in empathy when we're listening to people who have questions about the vaccine, and also be respectful of their choices when it comes to their vaccine behavior. And next, we have the third pillar, which is to engage communities and individuals. And our objectives is to engage communities in sustainable, equitable, and inclusive in an inclusive way. And that includes using communication, a two-way communication to listen and increase collaboration and build trust in COVID-19 vaccines. And this is actually one of my favorite pillars because I think it's one of the most important. And that includes working with jurisdictions and communities to engage partners for vaccine distribution. We work with partners and jurisdictions to collaborate with communities around vaccine uptake and service delivery strategies. And we collaborate to trust with trusted messengers and communities of color or elsewise to tailor and share culturally relevant messages and materials. And another thing I want to highlight is just that two-way communication. So yes, we are creating messages and putting things together based on the scientific evidence that we have and based on our understanding of broad understanding of vaccine behavior. But it is critical for us to also engage in two-way conversations and take opportunities to listen to communities and find out what are their questions, what do they need to know, what do you need to know, where can we improve our communication so that information is clear and people can be more confident about the activities and the behaviors that they engage in. So, given that framework of what we use to guide how we communicate about COVID-19 vaccines, we have a set of 7 vaccine messages that you'll find throughout all of our materials. And they include you can help stop the pandemic, people 12 years of age and older can be vaccinated. We encourage everyone to use reliable sources to get information, that COVID-19 vaccines are safe and effective, and we do have data to support that in case anyone needs to know, how do we know that it's safe? How do we know that it's an effective vaccine? And COVID vaccine is free. After COVID-19 vaccination, you may have some side effects, but those are all completely normal. And it's a sign that your body is building protection. And finally, that fully vaccinated people can resume activities once they are fully vaccinated. And we define fully vaccinated as individuals who have had the 2-shot, the mRNA COVID vaccines that entail 2 shots. After their second dose, they have waited 2 weeks after that final dose, and then they are fully vaccinated. And individuals who are vaccinated with the Johnson and Johnson vaccine, which is only 1 shot, 1 week, 2 weeks after they receive that shot, they are then considered fully vaccinated. So, with those 7 messages, we have a whole suite of information that we make available to the public and anyone else who would like to use this information to learn more about vaccines. One of our primary means of communication is through our website. We have HTML pages, which is basically just a website. And those pages can be translated into English, Spanish, simplified Chinese, Vietnamese, and Korean. And the way that you do that is you go to the top of the page. I don't know if you can see this very well, but there is a little pull down that says language, and you click the arrow and you have a pull down that you can pick the language that you would like to view the page in, and it will translate everything on that page. In addition, we have some materials that will be available in specific languages, and those usually come in by special request. when we have jurisdictions or partners that say, hey, we need a different language because we have a community that has a need and there's nothing available, we will engage in helping that community to get the translated materials that they need. Another important page on our website is the vaccines.gov page. And vaccines.gov is powered by Vaccine Finder, and it's a web based system that helps people find the latest information on COVID-19 vaccines availability. So one could put in their zip code and then look for all the providers, vaccine providers in their community. So it's a way to ensure or at least facilitate that people getting access to COVID-19 vaccines. In addition to our website and the vaccine finder, we have a suite of COVID-19 vaccine toolkits. And of course, I'll be talking about the community-based organization vaccine toolkits, but the toolkits are grouped by audience or setting, where we try and give very specific guidelines or recommendations about how to engage in COVID-19 awareness or set up vaccination clinics to specific audiences, just things to know about specific audiences or in specific settings. So when I talk about the community-based organization toolkit, this toolkit was specifically designed to help educate communities on the importance of COVID-19 vaccination, and it was designed for staff of organizations serving communities affected by COVID-19. And that doesn't mean the people that use this toolkit have to be, some type of specialized professional. It could be a volunteer-based organization. It could be social service organizations, faith-based, youth-led, meal delivery services, senior centers, fraternities, sororities, school organizations, any group that is outside of like maybe the healthcare system that feels that they really want to communicate with their audiences, with the people that they work, live, and play with, that they have the tools that they need so that they can educate their community about the true facts about COVID-19 vaccine. So I'll dig a little bit deeper into the community-based organization toolkit. Within the toolkit, and all of this information is on our website. If you go to the website and you go look for toolkits and you pull up community-based organization toolkits, you'll see a suite of materials that are all listed, and you can pick the materials that you want the most or that you're most interested in. But some of those include a presentation, a PowerPoint presentation that you can see on the screen. We have some FAQ documents that contain questions that we've received nationally about COVID-19 vaccines. We've condensed those into FAQ documents and also includes those key messages that I referenced earlier. We have printable materials and graphics. So these materials are available in color, but they are also nice looking when they are printed in black and white. And we did that on purpose so that, even if you don't have a color printer, these still are attractive documents that you can hand out. We have some note cards that we also have available that are in different languages. Like I said, we have them in Spanish, Korean, Russian, and simplified Chinese. And you can print those up as well and pass them out. In addition, we have a variety of printable materials and graphics that includes posters, which are in PDF format. We have stickers. You just need to take a sticker sheet and put it in your printer, and you can have some of the stickers that you might see other people wearing in black and white and in color. We have infographics about how the vaccines actually work, because we get a lot of questions about, how exactly do COVID-19 vaccines work? What do they do to the body? And we also have photo novellas, which are available in different languages as well. And a photo novella is a visual story of information. So rather than you relying on a lot of words, you can look at the pictures and pick up what the information is trying to tell you. And this story is about the benefits of COVID-19 vaccines. We have customizable content, and this is information that's already drafted, so you don't have to come up with the language and how to put all these things together, that you can copy and then customize it for whatever group you want to customize it for. You can put your own logos in and add your own text. Like if you want to include a letter, you can have it signed, whomever is important to have it signed by. But we have an introductory letter, we have a letter to members if it's like a member organization, as well as newsletter content that you can download or you can copy and put into whatever content that you think is appropriate for your community. We also have social media posts and assets that you can use. You download different graphics, and then we also have text that accompanies the graphics that you can or cannot use. It's your choice. But we have two different types of social media assets. One is the portrait, where you have the faces and it says protect against COVID-19. And then we have others that are more, illustrated with the graphics. So you can pick and choose any ones that you want to use. There's no limit to which, how many social media messages you want to download and use. They're completely free of use and available for you. And included in the community-based organization toolkit is our latest information about vaccines for adolescents. And those pages have information that are FAQs that are intended for parents of children and adolescents, as well as pediatric healthcare professionals, just to help them to understand what they should be saying and what they should know about COVID-19 vaccines for children 12 and older. And again, those materials are printable. So if you want to share them within the community or share them with healthcare providers, that is there for your use as well. And I mentioned a little bit earlier that we have additional materials in case you want to go beyond just raising awareness and telling people about COVID-19 vaccines. You can also set up, mobilize a vaccine clinic. And we have a couple of documents that are available to help walk you through that process. And that includes working with your community health department, state health department, or other organizations so that you can deliver vaccines to communities. So we have the toolkit that has all of these different resources, but in addition to that, outside of the toolkit, we have a page on the website that's called Communications Resource Center, where we have additional links to toolkits. For instance, we have a toolkit for essential workers and a toolkit for health systems and long-term care facilities, people with disabilities, et cetera. So there's a whole suite of toolkits that one can access. We have additional print resources, web widgets, which are little pictures or graphics that you can put on a website. And if you click on that image, it will take you to CDC's pages, vaccine COVID-19 pages. We have a whole suite of social media graphics that go beyond the ones that I reviewed today in this toolkit. And we also have videos, again, that you can download and post wherever you think it's appropriate and share within your community. So for your reference, these are the websites that I mentioned. This is the Toolkit website, the Print Resources website, and the Communication Resource Center website. I will have this slide presentation available for you, so there's no need for anyone to copy it down right now, where you can, peruse through these materials as you see fit and download them and click around as much as you want to. So with that, I'm going to close this presentation, but I am happy to answer any questions. In fact, I invite you to ask as many questions as you want about the toolkit, in addition to any questions that you have about COVID-19 vaccines.
Thank you, Stephanie. So we do have a few questions, and I do want to encourage everyone to please, if you have any questions or comments, please either use the chat box or the Q&A box, or you can also raise your hand and I will unmute you. So the first person we have is Annette Guerrera. I'm going to unmute you so you can make your comment or ask your question.
I don't think I had a question. At the beginning, you said that we couldn't hear you. So I was just saying, yes, we can.
Oh, okay. Thank you.
Yeah, no worries.
Okay. And we do have a question in the Q&A box. In anticipation of gearing up for schools to start again in the late summer, how can we tailor our messaging to include getting your COVID-19 shot in addition to other vaccines school-age students may need? It's a three-part question. So do you want to answer that part first, and then I can go on to the next part of the
Yes.
question? Okay.
Thank you. Yeah, I appreciate that. I do have a short memory. So, um, so that's a great question. And that is language that we have anticipated and should have available on our website, where we do encourage parents as well as healthcare providers when they have someone either in their office or they're talking to, a parent is thinking about COVID-19. We do encourage them to also use this as an opportunity to get caught up on routine vaccines, including vaccines that are required for participation in athletics or travel. And there's no issue with co-administration. And that was a question a lot of people had, but they have done the studies, and it does not seem that there's any issue with co-administration of the vaccines. And again, I want to say that I'm no longer on the task force, so I'm not sure what's available today on the website. But I know when I was rolling off last week, there was language that was going up that gives you precise language to say, use this as an opportunity to get caught up on any additional vaccines, and co-administration of vaccines is safe.
The next part of the question. I know some of our orgs work with two separate entities to roll out HPV vaccine or other vaccines versus where individuals can get their COVID vaccine. Will there be any information that is out on how we can promote comprehensive vaccination for school age students in addition to promoting the COVID-19 vaccine?
So just to piggyback on the comment I'd said before, we are working with healthcare professionals and health systems to encourage them to be prepared to offer both, so that individuals don't have to go, to one clinic to get the COVID-19 vaccine and then maybe another clinic to get HPV or other routine vaccines. And that's something the community can also encourage by saying, hey, it's better for us if we're able to get our vaccines all in one place as opposed to going, multiple different places, because really it's the community that drives action. So we are encouraging healthcare providers, but we certainly cannot make them do anything. And we're trying to make it so that when they order COVID-19 vaccines, they're in a dosage. Their orders are small enough that they don't feel like they're going to waste the vaccines. So anything we can do to facilitate them offering both COVID-19 in addition to any other vaccines that they typically will offer, we're trying to do that and make that an option among healthcare providers that advise and treat adolescents.
Thank you. Next question. Do you have information on how to set up a community clinic at a school?
So I don't have information specifically about setting up a clinic at a school, but we did do a presentation just last week with the Department of Education, and they are completely committed to offering COVID-19 vaccines, or at least information, as much as possible. So if that is something that you're interested in doing, I suggest that you coordinate with maybe your local health, not local health department, but your local board of education or school system and superintendents, because and if it's a public school, because they have all that information. They're actually receiving additional funding and can apply for additional funding to do just that, to offer vaccines at the school. If it's a private school, I would say you would also want to hook up with the health department or whomever is offering vaccines in the community from the state or from from Indian Health Services, so that they can coordinate the administration of vaccines on a school campus, and of course work with the administration of the school. But it is something that we encourage and we strongly support at CDC.
My next question, are there issues of consent for youth to receive the vaccine?
That's a great question. So on a national level, we just there's nothing that we have on a national level that's an issue. Rather, consent and assent is a state by state, jurisdiction by jurisdiction um, issue. So you have to look into the laws that are within your jurisdiction in terms of consent and assent. And so most of the time, it's appropriate for parents to be the ones that offer consent, and then they do ask the youth, if that's something that they want to do, but that doesn't mean that that's always the way it works. So it is very specific to your jurisdiction, and I wish I had more details about that, but that's just the way our country is set up. So if you have additional questions, we do have a fact sheet on our website that specifically talks about consent and assent. Ultimately, it will lead you to a link that will take you to what in your state, what the laws are about consent and assent. That's an excellent question.
Yeah, do you have a few more questions? Some patients have expressed fear in getting vaccinated after they have already contracted COVID because they have heard side effects could be worse for people that have already had the virus. Do you have any suggestions on how to answer those questions?
Wow. So we are aware that people are nervous about um, whether or not they should be vaccinated once they've had COVID, they've had the actual infection. Our only guidance really is that they wait 2 weeks because, we there's so much that we don't know about this virus. So that we say wait 2 weeks because that's usually the amount of time it takes for a person to recover from a COVID-19 infection. In terms of having worse symptoms from administration of the vaccine, um, it's really not associated with whether or not you've been infected with COVID. It's really based on an individual's body. And so there are people who have had COVID and have gotten the vaccine and have had no worse symptoms, side effects than anyone else. And those side effects are typically pretty mild. They include soreness of the arm where the vaccine was administered, a little fatigue, maybe a headache or a mild fever, for a day or two, but they typically don't go beyond that. And for some people who have never had COVID-19 and then get a vaccine, they have more pronounced side effects after they have administration. But again, that is all based on that person's individual uh, body. And there's no way to know how you may react. But, I think one thing that's comforting is that, there's been no one who's had a very severe reaction to COVID-19 vaccine in terms of the side effects. There's been no one that said, I was sicker with the side effects than I would have been if I had COVID-19. That doesn't exist. Um, and so that's something we like to harp on is, a few days of discomfort is, I think, is worth it versus getting the actual infection or getting reinfected and having long-term consequences and not knowing what the outcome will be if you have the infection. Um, and I mean, it's really, I think people have fears because they don't know what to expect. And that goes back to that framework about having confidence in healthcare providers and showing healthcare providers showing and demonstrating that they have been vaccinated. So I encourage you to share your story. If you're a healthcare provider or you work in a healthcare setting, what has been your experience? Have you had severe side effects? Have your staff had severe side effects? Have what has been their experience, just so that they know people around you have had they've had the vaccine, they've had side effects, or they haven't had side effects, and they're still good. They're completely recovered, they're doing well, they're walking around, they're smiling, because you just want to see, is this something that I should do? Because I don't know anybody who I know for sure has been vaccinated. So I really would encourage you to share your personal stories once you've been vaccinated.
A few more questions. So you showed some images and different infographics and posters. Are tribes able to like switch out those pictures for maybe some that are more relevant for
Yes.
their areas or communities?
Yes, I'm glad you asked that, because we talked a lot about. Well, I talked a lot about tailoring materials, and recognizing that there's no way we could have images that represent the rainbow of individuals that live in our communities. So we do offer materials that you can sub in pictures that are more appropriate for your community. The way to do that is to go through, either through us as CDC, and I have our email address there where we can send you files that you can edit, as well as community. There's a community-based organization that we've partnered with that has done a really exceptional job of helping communities to pick images and language that fits their specific needs. Through a company called IDEO. So that is someplace where it's available to everyone, and we've partnered with them so that we can have very tailored messages and materials. And I can share that with you all after this presentation if that's of interest.
Thank you. Um, there was a comment also. So it's not in the toolkit, but a link to the tribal specific guidance and tools available on CDC has been shared in the chat box for those who are interested. Um, another question, sorry, pull this up. So when looking at the toolkit, what would be, or how would you recommend um, tribes utilize the toolkit for their areas as far as implementing or utilizing the fact sheets or toolkits?
So I'll go back to the point about tailored information. So it would depend on, first, I would find out in your particular community, in your tribal community, what are what are the predominant concerns and questions? If people are, let's say that people are hesitant about, not hesitant, they're not as confident about taking their children to get vaccinated because they're afraid of, whatever the case might be, then I would probably focus on answering questions that they have about adolescent vaccines. So I would start with maybe the FAQs about adolescent vaccines because that answers some of the questions and brings up some of the misconceptions and myths that we've heard about the vaccines. If there are additional questions about that, then I would engage CDC and pull up some more, detailed information. So maybe if people want to know, I want to see the data. So we have a vaccine, we have science, a tab for science on our web pages. So I would pull that up and maybe combine that with any presentation. If you're going to be in maybe a town hall, you can pull up that web page and go through it and say, this is the evidence that we have to say that this is an effective vaccine, and that, this is how effective it is within adolescents. So ultimately, what you're doing is listening to what people's concerns are, and then delivering information that addresses or answers those direct concerns or questions. Perhaps the issue is about access. Well, in that case, people are not really looking for, I need more information to know that I'm making a right decision. It's just, how can I get my body to a place where there are vaccines being offered? So you would, tailor your communication to, here are all the ways that you can get vaccinated. There's going to be a vaccination site here. We've worked with IHS, and they're going to do a clinic there. So you're just really providing them the specific information that they need to make the decisions about whether or not to get vaccinated. And again, it's there's really never too much communication that you can do. If you want to try and get people interested, I would recommend just putting up, FAQs here, wherever people go. So if they're going to the library, you have FAQs on a table, so people can pick them up if they have questions. If you have a website somewhere, or maybe there's, some type of school, getting back to school activity, that in the flyer you have a link to where people can get information about COVID-19 vaccines. So just making the information available, so that people have it when where it's available wherever they are, and then they can follow up with you with additional questions or whomever is the point of contact.
Another question. So now that summer started, we have youth summer camps and sports that are starting. How would you suggest involving coaches and parents, or elders, or those, leading like the summer camps in the conversation around vaccine confidence, or what messages would you suggest using?
So I would start again with our 7 key messages about COVID-19, just that it's safe and it's effective, that it's available for children 12 and up. And I like to talk about the benefits. So as they're preparing, people have questions like, what do I need to go to camp, or what do I need to bring with me, for practices? And that's where you would say, we recommend that everyone, who's unvaccinated wear a mask, because I don't know the circumstances of whatever the camp is if you're going to be inside. But then you can say, however, people who are fully vaccinated don't need to wear a mask, and highlighting that, because that's a benefit. You get to be free of a mask if you're in this environment. And there's lots of ways to make that, to encourage it, by just continuing to say, if it's possible, we recommend that you are vaccinated before you come to camp, or if it's possible, we recommend that you are fully vaccinated so that you can be mask free when we go to the pool, etc. So you're telling people this is you're using carrots and sticks. So the carrot is, this is what you get at the end. If you are vaccinated, here are all the things that you can do. If you're not vaccinated, we understand, but that means you're going to have to wear a mask, and you won't be in enclosed places like, with some others. It won't be the same experience as what you're accustomed to experiencing, before COVID. And so just kind of continuing to use the carrot and the stick. And that extends beyond just the children who will be participating, but it includes the parents. If you want to sit in the bleachers and watch your child play this sport, then we recommend that that you are vaccinated, so you can shout as loud as you want to, and won't be, your encouragement won't be blocked by that mask. So just little ways to encourage people about, these are all the benefits of getting vaccinated versus not being vaccinated. And if you want to include some follow-up information. So if you're sending out information saying, hey, these are all the great things that you can do if your children and you are vaccinated, for this camp, you follow up with information about, this is how you get more information about getting vaccinated. This is where, the clinics will be, or we're going to offer clinics maybe during registration, vaccination clinic during registration, so that you can have a great experience during this camp. And those are just a few recommendations, but it's really just harping on that idea that the more people that, that are vaccinated, the more we can get back to the life that we're accustomed to, and engage in the activities that we were accustomed to, prior to COVID. And we can get past this, all the limitations that we've experienced before. I hope that answers in part some of your questions.
There's one more question. You mentioned something about misinformation. Are there messages in the toolkit that can be used to kind of combat misinformation that is going around?
Yes, absolutely. That is a part of, our FAQs, where we have frequently asked questions. In addition, we have a page called Myths, and Facts on the CDC website, where you can, where it goes down different myths that we've heard. And it gives you all the language to talk about it, and you can put it into your own words. But, one of the myths, for example, that we've heard is that, the COVID-19 vaccines change your DNA. And so we have, some language that explains that it does not, affect your DNA at all. And then we have the fact sheets and the infographic that shows you exactly how the vaccines actually work. It was one of the images that I showed, and that's a way of combining both, this is the fact, and then let me show you something to further break it down so you understand that, there's no way that your DNA is even affected by any of the vaccines that are available. So it really depends on what those misconceptions are and that misinformation is. We also have social media messages that kind of hint at some of those rumors that we've heard that just kind of underline with the facts. We don't want to promote any of the misinformation. So we really focus on what's the accurate information. So rather than saying it will change your DNA, hey, we heard that it'll change your DNA, we say proactively, COVID-19 vaccines do not change your DNA. They are safe and effective, and leave it at that. So there's a plenty of information on our site that can help you address those things. And if you come across things that you haven't heard or you don't see that you've never heard before or you have not seen on our website, please, please, please share that with us, because we can't be everywhere. And there are some communities that have brought up different misinformation that they've heard, and we can quickly gather information to address those concerns as we hear them, but we have to know about them first. So I'd encourage you to use that email address or any other contact individuals you have who are working with CDC or working with IHS or working within the health system that you look to for reliable information. Tell them that these are things that we're hearing, and we need some language, or we need some tools to address this concern. It is our pleasure to create these materials. Our goal is to empower everyone to make the right decision for them. And we want to make sure that the resources that we provide are accurate, they're culturally relevant, that they are informative, they're delivered in the right way, because we really are ultimately concerned about the health of everyone in this nation. So whatever we can do to help people get to a point so that they can be their healthiest, we are willing to do. We're willing to do anything we can to support that.
Are there any additional comments or questions? If so, you can type them in the Q&A box or the chat box, or if you raise your hand, I can unmute you so you can ask your question verbally. Okay, it looks like we don't have any more questions for you today. If you happen to think of any questions after the webinar is over, you can email me and I can pass those questions along, or you can send your emails to the email address on the screen. I want to thank everyone for joining us this afternoon. You will also receive a link to an evaluation to fill out. We really ask that you complete that just so we can make sure any future discussion groups are relevant and timely and meet your needs. So if there's nothing else, we will go ahead and wrap up, and the recording will be available in a few days. Stephanie, thank you again for joining us this afternoon.
Thank you so much. I appreciate the opportunity, and please share your feedback and your questions with us. We love to hear from you.
Everyone, have a good afternoon.